Good morning. I'm Peter Kovacs. I'm the editor of The Advocate and the Times-Picayune, and welcome to our virtual town hall. And we're here with Governor John Bel Edwards, who joined us once before and is here to talk today about Phase 1 and how it's going to work and answer your questions. Today's virtual town hall is sponsored by AARP, and we will start out with a message from AARP, and then maybe the governor can talk about what's going on today, and then I have lots and lots of more than 100 of your questions. And one thing I should assure everyone is that there are only 5 of us in the room today, and we're all 6 feet apart from each other, including the governor and I. So we are behaving safely and complying with guidelines. Anyhow, let's hear from AARP.
AARP Louisiana would like to thank the Advocate for hosting this important conversation with Governor Edwards. We'd also like to thank the governor for his leadership during this crisis. Dealing with the coronavirus pandemic over these past few months has certainly been challenging, but especially for older adults and for people with underlying health conditions that put them most at risk. Many are more dependent on caregivers, family, and friends than ever before to help get the food, medicines, and supplies they need to help them safely shelter in place. So AARP wants to take this time to thank all of those who have helped in this time of great need. From the food banks and senior centers to the volunteers calling folks in their homes to check on them and keep them company, thank you. To the pharmacists and grocery store clerks, to the doctors and nurses, to everyone on the front lines helping to keep us safe, thank you.
Okay, welcome back. And I thought maybe we would start out with the governor sort of telling us a little bit about what's going on today and what's going to go on tomorrow.
Well, thank you, Peter. So normally we update our numbers on our public-facing dashboard every day at noon, and we will do that. Just before coming into the room, I was given the case count for today, and I wanted to go ahead and start with that. So today we're going to be reporting 827 new cases, which is a much larger number than has been our daily average over the last few weeks. But like yesterday, we had a new large lab come online today and reported for the very first time, and includes cases that go all the way back to March. And in fact, 609 of those 827 cases actually came from that one lab. So if you take and look inside the numbers, the real number of new cases is 218. That's really in line with where we've been over the last several days. But these will bring us to a total of 33,489 positive test results across the state of Louisiana since the very beginning. The cases that we're reporting today are on 9,684 tests, which is obviously a large number of tests for one day. Unfortunately, and every single day we report deaths, we're reporting 36 more deaths today, Peter, and the total now is 2,351. I don't yet have hospitalizations. They have been declining steadily, even as the number of cases go up. And by the way, the raw number of cases is going up, but the percentage of cases to tests administered has actually been going down, which is
percent of positive results. You mean,
yeah, that's right, and so that's actually a good thing. But obviously we will get information soon on hospitalizations and on vent usage. When it comes in during this hour, I will share with everyone. But you're going to see these numbers come up on the public-facing dashboard at LDH here pretty soon. And I did want to start by thanking you and all the folks at the Times-Picayune and the Advocate for your coverage and making sure that we're communicating with the people of Louisiana. I suspect, the media is important every day. The press is important every day. But during a public health emergency, it really becomes much, much more important so that people have access to really good, reliable, factual information. And I want to thank you and all of your folks for helping make sure that that's happening.
Okay, well, we appreciate that. And one thing that happens from our side during these emergencies is the amount of digital traffic and the degree to which people are paying attention to the news is much greater, partly because it is an emergency, and I think also in this case because there's no sports to pay attention to. And so that's been a complication.
Although last night we had a pretty good hour-long special on the LSU football season.
see that,
It aired on the SEC channel, and I made sure that I was able to watch that, and got a lot of enjoyment out of that. And of course, it has me, like many other people, looking ahead. I don't know what to predict for the fall. I really don't. I can tell you aspirationally, I really can't see us having a fall without our universities, having students on campus and games in Tiger Stadium and in other places across the state as well. So I'm hopeful that we will get there. It's just a little too early to know.
Okay, well, it's watching old sports is not what we had in mind, but it never gets old watching LSU beat Clemson, does it?
No, it doesn't.
So anyhow, let's go to the questions. As I was mentioning to you before we got started, a lot of the questions are all very respectful generally, and I'm going to try to hit kind of the thematic points of the questions. A lot of the questions are about, particular individual circumstances and why is this rule set up that way. The first question is from Paul in Baton Rouge, who says, can youth baseball tournaments be played as of now with appropriate social distancing for the fans?
Yeah, so the answer is yes. And what we talked about was not having contact sports. And baseball is sort of in the middle between contact sports and non-contact sports. But we've made the conscious decision that baseball and softball can go forward. But we do need to make sure that spectators are social distancing. And by the way, one of the reasons we can do this is outdoor activities are inherently safer than indoors. Indoors, you have recirculated air because of the HVAC systems. But outside, you have the wind blowing and so forth, and it's safer. But we do need spectators to wear masks to make sure that they're not within 6 feet of one another. And then they can spread out, not just in the bleachers, but also around the field and so forth. And we don't believe that kids ought to be in the dugout all at once. But there are ways to do that. But baseball and softball can go forward in phase one, absolutely.
Okay, well, that's good to know. Dan of Hammond says, why can't bars open that do not serve food?
Because the atmosphere of a bar is such that it is very conducive to the spread of the virus. And in those bars that have LDH food permits, they are going to be required to operate just as a restaurant does, and so that no one's going to be able to stand around and have drinks or to eat. They're going to have to be seated at tables, and if they do have people sitting at a bar, they're going to be sitting 6 feet from one another and so forth. But bars that are not serving food, and this, by the way, is a recommendation that came from LDH, but also from the White House Coronavirus Task Force guidelines that the president issued, that CDC vetted. And look, it's a tough decision to make. In fact, none of these decisions have been easy. This is certainly not the way that I want the state to function. But at the same time, we have to try to manage and strike the right balance between the competing priorities of public health on the one hand, the economy on the other. We do hope as we can move forward and get through phase one and into phase two that more of the economy will be opened up again in a safe way. But at the present time, it is just not recommended, according to the public health officials, that we reopen bars outside of those that have food permits and that will function in exactly the same way as restaurants do.
Okay. This is from Armand of Lockport. Says a waiter or waitress makes $2.13 an hour plus tips, and with only 25% capacity counting employees, how are they supposed to make a living?
Yeah, it's tough. But and again, that's an economic discussion, which is very, very important. But you also have the public health aspect of this as well. One thing that I would point out is that we will have much more people, for those restaurants that can do it and choose to do it, they can have outside seating. And that's not limited to a percentage of occupancy. It's limited strictly by what you can, how they can social distance. So the bigger the area, the more people that they can safely accommodate. And you're going to be able to engage wait staff on those tables in phase one as well. And so we hope between the 25% indoors and what many restaurants are going to be able to do outdoors, that the vast majority of waiters and waitresses will be able to make this work.
Oh, okay. So this question comes from Jeffrey of Lafayette. Don't you think it's way too soon to start reopening the state? We have no testing or a lack thereof. Regardless of what the president says, Dr. Fauci says it's way too early and more death and illness will come.
Yeah, well, first of all, I don't know that Dr. Fauci has ever, in fact, I believe he has not, disavowed the White House Coronavirus Task Force guidelines that have a phased reopening. I was unable to watch his interview. I can't remember if it was yesterday or the day before, but I don't believe he's ever disavowed those guidelines. I think what he's talking about are those states that don't meet the guidelines for beginning to reopen. And I'd like to say several things about that. First of all, we looked at the guidelines when they came out. These are the president's guidelines vetted by CDC. We think that they make sense. And so over a 14-day period, in order to move into phase one, you have to have a downward trajectory of people presenting to emergency rooms with COVID-like symptoms. You have to have a downward trajectory of positive cases, either as a raw number or, and I think this is more important, as a percentage of the tests being administered. And you have to have a downward trajectory on hospitalizations. We satisfy all three of those. And then you also look at testing, and testing has ramped up considerably. We had 39,000 tests administered just in the last week. And we're on the way to 200,000 tests starting here in the month of May. And so we're ramping up the testing, and with respect to the guidelines, the testing, you really have to be able to make sure that you can do your healthcare personnel, but we're going to go way beyond that. And so I would tell you there's always an element of risk in it, but we meet the guidelines. We believe we can move forward. And if people will, and by the way, it's not a light switch, so we don't go back to life as we knew it before COVID-19. This is phase one. Some businesses remain closed. You had the conversation about the bar. Other businesses are going to be opening for the first time or expanding there, because I did not initially close anything related to construction, anything related to manufacturing. We accepted all of the CISA guidelines, and we're on the third version of that now. So the Department of Homeland Security, through the Cybersecurity and Infrastructure Security Agency, has developed guidelines about essential infrastructure. They're on the third version, and at no time have any of those essential businesses been closed. And we left all of the middle range of businesses open, although at a reduced capacity. Well, we're moving that capacity up to 25%. But if people will wear the masks, if people will make sure that they're distancing from people who are not part of their household, and washing their hands frequently and doing the other things that we're talking about, we can do this safely. But I will tell you, people who are vulnerable to this disease, and we know that if you're 65 or older, you're more vulnerable. If you have a chronic health condition, that comorbid health condition, such as kidney disease, heart disease, hypertension, diabetes, obesity, you really need to continue to exercise care. Understand that you are safer at home, and get out only when it's essential for you to do so. And so for that part of our population, really things shouldn't change between what we've been experiencing and what we're going to experiencing starting with phase one tomorrow.
Okay, thank you. This comes from Kenneth of Metairie. People 65 or older with underlying conditions that work should stay at home, but what if your employer says you have to work? Are you protected, and will you lose your job?
Well, first of all, these are very difficult decisions that people have to make. What you're going to see in the proclamation that I will sign later this afternoon that goes into effect tomorrow is we're saying that those people should stay home, but that they can travel for essential purposes, whether it's going to a doctor's visit, whether it's going to the store to get groceries, those sorts of things, and going to and from their place of employment if they have to work. But understanding that they are vulnerable because of their age or these conditions, then they owe it to themselves and their employers owe it to them to make sure that they are as safe as they can possibly be if they have to work. And you know, it's one of those things that every individual is going to have to decide for themselves. First of all, whether they should work under those circumstances and whether they need to work, because not everybody's situation economically is exactly the same. Whether or not if they don't work, they can get unemployment assistance. And at some point, as you know, I think that runs through the month of July right now, that enhanced pandemic unemployment compensation and so forth. So these are decisions, and I got a very similar question the other day. I had a conference call with about 700 pastors, and one of them said, well, look, I'm 76 years old, and I'm a pastor. I says, well, I can't make the decision for you. I can only tell you your status as a pastor doesn't get you some exemption from the CDC guidance. I can only give the guidance as it is, and I know that's a tough situation. But we believe in giving people the best, most factual, up-to-date information that we can, and then they're going to have to make their decisions. But we are lifting the stay-at-home order, but it will say that those individuals should stay home if at all possible.
Okay. This comes from Bobby of Winfield. He says, when are you going to open the state parks? My grandkids are ready to go.
Yeah. Well, as you know, the state parks come under the lieutenant governor. The proclamations that I've issued did not close the state parks. The lieutenant governor chose to do that, and by the way, I supported his decision. And he did that by working with local authorities in the parishes where the parks are. And I think in just about every case, they requested that parks be closed because otherwise you would have had more travel than necessary from one community to the other and from out of state into our state parks. He mentioned yesterday that the parks will be reopening over the next few days, and we have operations going on at 3 of the parks in the campground with travel trailers, so that we have places to house individuals who are COVID positive or people who are believed to be COVID positive and they're waiting for a test result to come in, but they can't go home either because there's a vulnerable family member in that house or because they potentially are homeless. So that's at Bayou Signet State Park in Jefferson Parish. That's at Chico State Park in Evangeline Parish. And that's also at Lake Bistineau State Park up in North Louisiana. But even in those places, the lieutenant governor is working to open up those areas of the parks that are not involved in those particular operations. But he made that announcement yesterday. And by the way, he similarly made announcements about museums as well, reopening. So hopefully Bobby will be able to bring his kids or grandkids, whatever it was, to a park soon and do it safely.
Okay. Jamie of Covington says, why are grocery stores not requiring shoppers to wear masks?
Well, first of all, wearing masks is a good idea. It's a CDC recommendation. It is something that the Department of Health is recommending. It is in our proclamation as to what people should do. I liken it to being a good neighbor. Peter, when you wear a mask, you protect others from yourself. And when they wear masks, they protect you from them. And I think it's good to reciprocate in that way. I'm encouraging everyone to wear a mask when they are outside of their home, whether they're outdoors or indoors, and are coming into close proximity to other people. Now, we are mandating that for businesses that open, the employees and owners of those businesses who are going to be working with their customers or in close proximity to the customers, they're going to have to wear masks. We're encouraging the customers to wear masks. But we don't believe that we should mandate it because we think that there would be a certain enforcement problem with that. And you've seen that in Ohio, I think, where the governor of Ohio initially tried to mandate mask usage. And you've seen it in a few political subdivisions around the country as well, where they had to retract that part of their orders. It just didn't work. But it is really important that people wear masks. And I've heard people say, well, look, I'm well. I feel good. I haven't been tested positive for COVID-19. I'm not going to wear a mask. The challenge with that is that there's a certain percentage of people out there, and it's not insignificant. It could be as high as 25% of all cases are by those who are asymptomatic. They feel healthy. They don't feel like they've got it. They haven't been tested, but they are nevertheless contagious. And that is a particular challenge around this virus. And so I ask people to be considerate of others, to be good neighbors. And some people will assert, well, I have a liberty interest. I shouldn't have to wear a mask if I don't want to. And the question there is, think not so much on what you have a right to do. Think more about what is the right thing to do. And so I understand Jamie's question. It is something we considered. I think it's a bridge too far. But we do want people to wear masks, and I'm encouraging them to do so.
Okay. This is from Barbara of Harahan. How are the restaurant requirements going to be enforced? Health department codes are swept under the proverbial rug, and our current situation is far too serious not to address this and continue to allow it to be ignored.
Well, first of all, we have been heartened by the degree to which business owners of all kinds want to open safely. And what business owners know, and first of all, the overwhelming majority of them are very conscientious people. They're responsible in the way that they conduct their business. They want themselves, their families, their employees to be safe, and they also want their customers to be safe. And in this situation, just as evidenced by the question itself, the public wants to feel safe when they go somewhere. And I will tell you, I believe those businesses that if they conduct themselves in a way that violates the guidance we've put out around social distancing, around mask usage, and other things, then they're not going to be successful because the public is not going to feel safe going there, and they're not going to go there in the numbers that the owners would like. Now, we've actually had very good results working with business owners as they've registered for opensafely.la.gov and asked questions, whether it's at the Department of Health or the Fire Marshal's office, about exactly how they should do that in order to be safe. But I would encourage the public, if you see something that you have a question about, address that to the owner or the manager of the business. At the end of the day, if you don't feel safe, don't patronize that particular business. But we believe that we're getting very good cooperation by the overwhelming majority of businesses out there, and actually have been, as I mentioned before, have been heartened by the conversations that we're having with businesses.
Okay, Nick emailed me a question this morning, and he says, businesses are having to operate at 25% of capacity, but state agencies are at full staffing.
Yeah.
I don't know if he's correct about state agencies being at full staffing, but I
Well,
think he's
it
speaking to the
depends.
contradiction.
It depends. So full staffing, we are encouraging work from home where that is possible. Our offices, for the most part, that receive the public have been closed during the stay-at-home order. You will see them starting to reopen tomorrow because we know that we have to reopen our offices, our state offices, things like our offices of motor vehicle, for example, LDR, so that people can come in and get assistance with their taxes. I mean, you name it, and you're going to see those things reopen over time. We will continue to allow people to work from home as we are able. And by the way, we're encouraging the private sector to do that too, if they're able to continue to do the telework. But we will be bringing people back in. But when you have a public health emergency, just like when you have a natural disaster, the state has to function. I mean, it is more important than ever that you deliver certain services, and you can't do that if certain state employees are not at work. So I'm not sure which agencies Nick's talking about, but But you will start to see tomorrow, as we go into phase one, more and more state offices open. For example, I can tell you by Monday, the 11 biggest OMV offices in the state will be open. By the end of next week, more will be open, and then by the following week, even more will be open. So we're phasing in state office openings as well.
Well, speaking of motor vehicles, one thing I remember from Katrina, this wasn't a question, but it occurs to me. One thing I remember from Katrina is that there was a period of suspension of all the requirements, like your driver's license being expired or your brake tag, because there was no place to go get that service. Is that in your order?
Yes.
And how long does that go on for?
It's been in the order since the beginning, and the order that I will sign today will be in effect through June the 5th. And what it says is that if your license expires, or if your brake tag expires during the public health emergency, it will nevertheless remain valid for a period up to 30 days after the emergency is over. And so you don't have to go in and renew, although you can now, most people can renew their driver's licenses online at LA Wallet. And we've waived the convenience fee for that, so that it doesn't cost more than it would cost if you went into an OMV office in order to make that happen. So if you're sitting at home and you want to go ahead and get that done and not have to go to an OMV office, you can do it now at no additional cost, and so forth. But yeah, that is in the suspensions that we've had in effect all along. It will remain suspended through June the 5th, and I don't know what comes after that yet, but I can tell you that we have taken that into consideration.
So Alex from New Orleans says, if conditions worsen in the weeks or months ahead, are you willing to reinstate the stay-at-home order or other restrictive measures?
Well, obviously, one of the reasons that we're testing more and more as we move forward is so that we can monitor the situation and see if cases spike. And it's not just whether cases spike and increase. It's a question of what happens then with respect to hospitalization usage and so forth. You really want to avoid having to go into a crisis care mode and that sort of thing. So we're going to monitor the situation. Clearly, we can, whether you call it going back in phases or whatever, you can put more restrictions in place. But Peter, I will tell you, as we do more contact tracing, and we will have 250 contact tracers working by the end of this week, we will ramp that up over time as necessary to make sure everyone who's positive gets contacted in the first 24 hours. And then within the 24 hours after that, all the contacts identified by them will be contacted as well. But as we do that contact tracing, we are going to potentially identify geographic areas or potentially certain types of establishments where we're seeing more and more of these cases. And it may result in the closure of those establishments or additional mitigation measures. We had a call earlier, or you had a question earlier about bars. I don't know if you saw this, but Seoul, South Korea recently had to close 2,100 bars because as they reopened their economy, and you know, people think that they did a pretty good job of high capacity testing early, and kept the number of cases suppressed. They re-engaged, opened bars, and had to go back and close 2,100 bars in Seoul because of the transmission of the virus and the hotspots that had developed. And so certainly we have that option. I am hopeful that people will re-engage responsibly and in accordance with all of the guidance that's out there, and we won't have to go backwards. And that's why we're taking a gradual, phased approach to re-engaging the economy, because we really don't want to have to go backwards.
Okay. Gustavo, excuse me, asks, when will evictions be allowed to take place?
You know, that's a good question. We are going to remain with the current suspension through June 5th. I understand that can't go on forever, so we're communicating with various stakeholders, whether they are landlords or the court system, people in the housing community, but obviously that it can't go on forever. And one of the things that we've been consistent about is even though judicial proceedings have been suspended. Evictions have been suspended. The obligation to pay rent is not suspended. And people need to pay rent if they can. If they can't, they need to contact their landlord. Maybe they can make a partial payment, but not a full payment. But they need to be communicating with their landlord because at some point, obviously, not only will the public health emergency be over, but we can't continue to suspend this forever, and you don't want to dig yourself a bigger hole than is absolutely necessary. And I know that there are some people out there who are experiencing a tremendous hardship, but we also know that we've paid $1.5 billion out in unemployment assistance, and 80% of that being federal, by the way. But those individuals, in some cases, are able to make their rent payments, and we're encouraging them to do that because otherwise they're going to create a hole that's going to be very difficult for them to come out of. But we will reevaluate that situation as we move. But I can tell you that for the proclamation that I'll sign today, where phase one lasts through June 5th, so will the suspension of evictions.
Okay. Jamie of Gretna, speaking of what you just brought up, says, why 21 days for phase one instead of 14?
Well, that's a good question. I got this question the other day as well. Because you have to have 14 days of data that is accumulated during the phase. And you've got to be able to get that in, evaluate it, and decide whether to move to the next phase. Well, you don't have instantaneous access to data. It takes some time to get it in, to categorize it, make sure it's correct, and all of those sorts of things. And so if you have a 21-day period between phases, and that's why the order is going to be 21 days, it allows you to get 14 days. It allows you then to evaluate it, analyze it, make the decision, announce the decision before you are on that cutoff in time. And so we just thought the more logical way to sequence this and to create the certainty that people need and the predictability is to say that it's going to be 21 days. And by the way, there is no decision that can be made about whether to go to phase two until we actually get to that point where we have the data to look at, because we are going to continue to follow the White House Coronavirus Task Force guidelines for this phased approach to reopening our economy. It requires the same information that I discussed previously, the same threshold criteria to be evaluated over a new 14-day period. And the short answer is you can't go to a new phase and within 14 days get and evaluate 14 days worth of data and make your decision and communicate it in advance of when the change takes place. So 21 days is actually the shortest period of time that we felt comfortable with that we could do this.
Leonard from Ville Platte says, why are massage parlors not allowed to?
Yeah, and this was something that Dr. Alex Bu addressed extensively yesterday at our press conference. And so when you look at the kind of contacts that are especially conducive to spreading the virus, it has to do with how close the contact is and how long it lasts, and whether there's going to be physical touching. So it's obvious you can't give a tattoo from 6 feet away. And you are going to be in very close physical proximity to one another with touching for an extended period of time. And so for phase one, that particular type of establishment is deemed to be just too risky for the spread of this virus. It's not some value judgment that we don't like tattoo parlors or anything like it. It's just the nature of that particular business. And we do hope and expect that as we move forward in the phased approach, that we are going to be able to allow them to reopen with sufficient protocols and mitigation measures in place. But it's just not something we can do in phase one.
So Anna from New Orleans asks how you can get a job as a contact tracer.
Contact tracer.
Okay.
Well,
it's one of the few jobs that probably they're hiring right now.
Yeah, oddly enough, clearly the economy has taken a hit and unemployment's a real problem. There are several types of businesses that are doing very well right now. But to get to the question, so we have contracted as a state with entities to run call centers. Those entities, and not the state itself, are actually doing the hiring. And as I mentioned, by the end of this week, which is tomorrow, we should be at 250 contact tracers total. And with the ability over the coming weeks to very quickly ramp up to 700 should we need it. And of course, if we need to go beyond 700, we will. And so we have put out information through the LDH website about anyone who wants to become a contact tracer and wants to be hired to submit information online. And that information is contact tracing at LA.gov. And we've had well over 2,000 people within the first 48 hours or so submit information trying to get one of those 250 jobs. And look, there may be additional people that need to be hired. Some people will be hired and won't work out, and so there'll be vacancies. And so anyone interested should go ahead and do that. I do want to point out that even though we're engaging call centers to do this work, the work is actually going to happen all over the state of Louisiana because the vast majority of these people are going to work from home. And so we won't be bringing people into call centers for a couple of reasons. One is we really want to hire people from all over the state of Louisiana to do the work. Secondly, is we have a public health emergency, and we don't want to bring more people together in close proximity than is necessary. And so the vast majority of these contact tracers will be working from home with the telephone that they need, with the computer that they need in order to do their work.
So just to understand the contact tracing experience, if I get a call from the contact tracer saying, look, we think you were in church last Sunday and one of the people in church has tested positive, like what are they telling you to do?
Well, first of all, you're not going to get a call that says that. You're going to say, we believe that you were in close contact, meaning within 6 feet for 15 minutes or more.
Oh, okay.
Okay. So it's not everybody in the
whole
church.
Okay.
It's within 6 feet for 15 minutes or more, and therefore you need to know that this individual has tested positive. We tried to figure out as best we could when he became contagious or she became contagious, which is up to 48 hours before they become symptomatic. And then you get the contacts from that point forward. You start calling those individuals. First of all, they want you to know, and the overwhelming majority of people want to know if they were in close contact with someone who's positive. Secondly, they're going to ask you if you're symptomatic, you really need to be tested yourself. If you're not symptomatic, you don't need to be tested, but you do need to understand that you could have COVID-19 because some percentage of people are asymptomatic throughout, or so mildly symptomatic that they have it, and yet they can be contagious. And so you would be asked in that situation, if you got that call, to take a 14-day period and really isolate yourself. That's how you stop the spread of COVID-19, even as you re-engage the businesses and the churches and so forth across the state of Louisiana, get more employees back to work and everything else. You can rest assured that your information will be confidential. Nobody's going to go out and spread that information, but we are going to be asking that people agree to do the 14 days. And then again, it's one of those things, and we've been asked, well, what about this liberty interest if somebody says they're just not going to do it? Well, if they're not going to do it, they're not going to do it. We're not sending the police after them. But is that the right thing to do? It really isn't. I mean, and you see people, I can tell you that the head of the National Guard Bureau, he was here with me a few weeks ago, General Lingell. He went into isolation, and you've seen it with Dr. Fauci and others, and so it is just the right thing to do. And for people who want to re-engage more of the economy, get more people back to work, more businesses open, they need to know that we're only going to be successful if we keep the cases down, and we can only keep the cases down if we're doing the testing and the contact tracing. And as we trace the contacts, those people have to then do what we're asking them to do.
So this is interesting, and I think it will be interesting as it rolls out as a phenomenon. People will.
Yeah.
So do they tell you who you were in the room with for 15 minutes that you may have gotten it with?
You know, I believe that they do. I don't know that I've asked that particular question, because if they don't tell you that, then I don't know that you're going to believe
That's
what,
what I meant. Yeah,
they're telling you. And it's such a close contact for 15 minutes or more that that you know, once you get the name, I think you're going to understand. You know, and then in many cases you're going to have the opportunity to contact that individual, call them and whatever to confirm. And what we find out in many cases is once someone receives a positive case, a positive test result, they will take it upon themselves to start calling people that they knew. And so in many cases, it doesn't come as a surprise. Secondly, the contact tracing becomes harder as you lift the stay-at-home order and move into phase one, because you're going to have more contacts.
Yeah.
But it's a great question, and I'm quite certain that they do, and I'll get a more positive answer for you shortly.
Right. Rachel of New Orleans says, in this time of economic crisis, why is the legislature not considering the will of people and legalizing medical marijuana?
Well, medical marijuana is legal. So what's not legal is recreational use.
Okay.
And I will tell you, I don't know that the two go hand in hand. First of all, I'm not a proponent of recreational marijuana, whether it's during the time of a pandemic or otherwise. And I don't believe it's something that the legislature should do. I certainly don't believe it's something that they should be taking up right now, because what they should be doing are those things that are absolutely essential. You don't want to bring legislators, staff, and the public into the building and into the committee rooms and the chambers any more than is necessary, or keep them there longer than is necessary right now. So I 100% agree, and I've always said that the legislature itself is essential infrastructure. They need to be meeting, but they also need to be doing the essential work, and not just any bill that someone might want to have heard.
Okay. Chelsea of Covington says, when is testing going to be available for asymptomatic people with no signs of COVID?
Yeah, so that's a great question. We will get there as our testing capacity ramps up. Quite frankly, even though we're getting to 200,000 tests this month, we believe, and thus far we have been resourced adequately and we're on target, there still isn't enough testing capacity in Louisiana or just about anywhere else, as far as I know. And the CDC guidelines, I don't believe, have been changed yet, so that the general public who are asymptomatic can be tested. But as we move forward with the CDC guidance and the LDH guidance that went out last Friday, we are going to be doing 100% testing in congregate settings, even those people who are asymptomatic. So, for example, in a nursing home, with the residents and with the staff, regardless of whether they are symptomatic, we will be doing 100% testing. And then you also have to then build into your plan retesting, because if you come up negative on a COVID-19 test, you're negative today. That doesn't mean you're negative tomorrow or the day after. And quite frankly, once you do the 100% testing of the residents and the employees, it really becomes more important to test the employees, because those are the individuals who are going and coming. And so we are now testing asymptomatic individuals, but it's only in these congregate settings. As soon as we are able, with the adequate testing capacity, to move beyond that, we will, and we will certainly let individuals know.
Brad from Kenner says, when will high school teams be allowed to begin summer practices?
Yeah, that is a good question, and I am not prepared to answer it today. I haven't received any recommendations from the Department of Education on that. I haven't heard the Louisiana High School Athletic Association opine on that. I will tell you right now, we are saying that non-contact sports outdoors are fine. That doesn't include football, obviously, and so someone who not only played football but loves football. I hope we can get there. I don't know whether we will or not, but it's too early to opine. I will tell you that the folks who are working at the Department of Education, individual superintendents and principals around the state, and all the folks at the High School Athletic Association have player safety in mind foremost all the time. And when you have a public health emergency such as we currently have, obviously player safety, and not just player safety. These players come together, they practice, and then they all go home, and so they potentially bring home whatever they contract at practice. And so for all of those reasons, they're going to be very careful about this. I don't have any information really to give today, but I'm asking people to be patient and to just understand the nature of things right now.
So Joanne of Baton Rouge says she's 74-year-old female. Before the pandemic, I swam a half mile 4 times a week. I'm in excellent health. Am I allowed to resume my swimming workout at the Women's Center for Wellness?
Yes, in a lap pools,
Yeah.
I think is something that we can do. What we don't want to do is have people recreating in swimming pools and laying out and sun tanning, congregating, and all of those sorts of things. But as a form of exercise, in the guidance that the Department of Health is putting out, and in conjunction with the Fire Marshal's Office, going to a health club that has a pool that's used as a lap pool, absolutely. And I would encourage her to resume that and to get that exercise in. But we encourage everybody to exercise as they're able to do so safely. Get outdoors. That's the safest place for you to be when you're not in close proximity to people who are not in your household. And take advantage of the opportunity that you have to exercise. It puts you in better physical health to withstand the rigors of the disease should you get it, but it also reduces anxiety and everything else. But lap pools are good.
Okay. Mildred from New Orleans says, why are you extending the hospital facility at the Morial Convention Center when there are only 17 patients?
Yeah. Well, first of all, that is a great question. We've already incurred the expense to set it up, for one. Number two is we still have modeling that shows that there could be a resurgence that would require us to use it again. And so what we're going to do is we're not going to close it down completely and remove all of the beds and the equipment that we have in the Morial Convention Center. But we're going to engage, just like we're doing a phased reopening of the economy, we're going to do a phased closing down of the facility there at the Morial Convention Center. The PHU is already gone. The trailers that were there across the street, they're already gone. And over the next few months, starting relatively soon, you're going to see that downsize significantly. But we need to have the flexibility to go back and understand the Morial Convention Center was stood up at a time when our modeling showed that if we had stayed on the trajectory we were on, which was the highest case growth anywhere in the world, according to Johns Hopkins data and calculations done by Dr. Wagner at ULL, that we were going to exceed our capacity to deliver health care, and the hotspot was New Orleans and Jefferson Parish. But the Morial Convention Center was actually going to be a facility that would take patients, not just from Region 1, but from Region 3, which is the Houma Terrebonne area, and Region 9, the North Shore. So we will be phasing that out over time, but for the next couple of months at least, we are going to have some capacity there. And the idea is you take the less acute COVID patients, that they can be transferred from hospitals so that they can then have those beds available for more acute patients in the traditional hospital settings. And it actually has worked very well. We are very, very thankful that we were able to flatten the curve and not need it for more patients than have been treated there. And I don't know the exact number, Peter, but it's well over 200 patients that actually did get treated at the Morial Convention Center.
I think the 17 is a reference to what's there
What's
now,
there? That's
today
correct.
or whatever.
That's
Yeah.
correct.
So Gail of Baton Rouge says, will bowling centers be open in phase 1? And if not, why?
I can't give you that answer right now. because we were having a discussion about bowling alleys earlier, and I'm going to have one more conversation about it before I sign the executive order. So bowling itself is a low-contact sport in terms of having direct contact with other individuals. There are some concerns around the shoes, although we believe that they can be disinfected and that can be taken care of. But it is, I don't know if you're a bowler, Peter. I'm not really. I've done it on occasion.
Not a good one, but I
but
have
because
bowled,
I
yeah.
don't own my own bowling ball, the first thing I have to do is go in and find one. So I'm going to pick up 10 or 15 balls to try to figure out which one I feel most comfortable with. And that process is one that concerns some people. So I haven't made a final decision. I will before I sign the proclamation later today. And by the way, I think you may have hit on the only outstanding question that I have to resolve before I sign the proclamation. I just don't know the answer yet.
Just to give people an idea on a matter such as bowling,
Yeah.
you hear from health officials. Who else do you hear from on the question of, like, can they disinfect the shoes?
Yeah.
And what about the bowling balls?
Well, you hear from all of those folks, and so we actually, as you know, we have a Resiliency Louisiana Commission that has task forces set up, 15 of them, and one of them is dealing with those businesses that do like bowling alleys, and so they're talking with all of those folks, trying to figure out, do you really want to be in phase one? If you want to be in phase one, what can you do to assure the safety of your employees and your customers? And then they draw not only upon the Department of Health and so forth, but upon national associations and CDC guidance. And then at the end of the day, you just have to make that determination about whether you believe in phase one with certain restrictions that you can do this in a way that is safe. And the answer is not the same for every activity that is being proposed. And we don't yet have the answer on bowling. But this is just one example. And you go through this over and over and over for all of the different things that are happening across the state of Louisiana. And I'll tell you, it's a challenge, and the decisions are hard. You don't want to make a decision ever that creates an economic hardship for somebody, but you also don't want to make a decision ever that is going to unreasonably expose someone to the virus and to the disease. And so you have to try to strike the right balance. We're working extremely hard. I'm doing the best that I can. I'm not going to say that I am mistake-free, but I do want people to understand just a little bit about what's involved.
Oh, okay. Well, it's a similar question came from Victor, who says, why are tattoo shops closed but beauty salons aren't closed? Tattoo shops are cleaner than beauty salons,
Well,
in Victor's view.
yeah, and I think that may or may not be true, and other people would feel differently. I will just tell you that the guidance, the counsel that I have received from the Department of Health is to the effect that we can open barbershops and beauty salons safely with certain restrictions in place regarding mask usage, no waiting areas, frequent sanitization of the and disinfecting of the establishment and so forth. But they don't feel that way with tattoo parlors for the same reason that I gave you before, is that you've got to have prolonged contact, physical contact, in order to actually tattoo someone, and it's just not something that the health experts believe is reasonably safe for a phase one activity. We will be able to get there at some point.
Okay. Jerry of New Orleans says, how many doses of remdesivir have we requested and do we have on hand?
Yeah, well, first of all, it's a great question, and we are getting more today. We got some day before yesterday, and I wish I had the numbers. I didn't bring them in here. The question is not, it's how many we are requesting. We're not able to request it because there's only so much available. The federal government is allocating it based on the formula that they have. And it has to do with the total number of cases, the hot spots, how many people are in the hospital, and that sort of thing. And so we are getting some more today. We've worked with the hospital association, the Louisiana Hospital Association, and various hospitals to figure out how many hospitals want it and how much, and then we're trying to meet that need as best we can. And we're taking the remdesivir, and even though it's coming from the federal government to the state, we are giving it to Morris-Dixon in Shreveport because they're in the business of distributing drugs to hospitals, and then they distribute it pursuant to the allocation that is worked up with the Department of Health in consultation with the Hospital Association. So that's a second question I owe you the answer on, but we are getting our second shipment later today of more remdesivir. It's not as much as you might like in terms, or that anyone might like, just because it's so limited right now.
Okay. I thought we'd close out with, I asked Smiley Anders to come up with a couple of questions.
Smiley asked good questions.
Smiley asked good questions. His questions are unconventional, but of course he's unconventional.
Yes.
And, Smiley has been around a long time, and so he's probably lived through 10 or 20 pandemics.
And he's probably in that vulnerable population too,
He is
right?
in that vulnerable, and
Yeah.
he is working at home. I have not seen Smiley in a couple of months because he's working at home. So his first question is, when you visited with President Trump at the White House, did you bring up the fact that he called you a socialist last year, and did the two of you have a good laugh about it?
Well, we had a number of good laughs, and without talking about any specific things that came out of the campaign last year, what I was able to do with the president was to reaffirm my commitment to working with him and with his team at the White House and at CDC and HHS and everywhere else across the federal government in order to govern. That's a commitment I made on the Monday after the election, Peter. And if there's ever a time to work together to govern and to not engage in partisan politics, it is now. So I was able to reaffirm that. The president and I did have a good laugh about things related to the campaign and some other things as well. But I don't want to betray any confidences I should keep between me and the president.
Okay, and Smiley's other question is, we've noticed that wearing masks actually improves the appearance of some people. Will these people be put in a special category and required to wear masks indefinitely to make our state more attractive?
Oh Lord! Well, Smiley, that's funny, and I might be one of those individuals. But as I mentioned before, we're not going to mandate any mask usage, but we are highly encouraging people to do it. I have been amazed at how many people have made masks and facial coverings, and what's being depicted on them, and whether it's a cartoon character or a superhero or delivering a message of some sort. But Smiley, that is a good question, and I will have to take that under consideration. But I suspect I won't change my executive orders in order to mandate any mask usage, although I don't want to end on that note. We are encouraging everybody to wear masks when they are outside of their homes and within 6 feet of people who are not in their household. In fact, wear them more broadly than that, but because you're protecting others from yourself, and they're protecting you from them when they wear masks.
Okay, well, as always, very well explained. I've always admired your ability to remember facts and keep up with the details of this thing, down to bowling.
Yes.
And, anyhow, hopefully we will do this before phase 2 and get together again, and we'll have more questions from readers.
Okay, we'll be happy to do it, and I'll have the bowling answer for you pretty soon, and the remdesivir answer for you pretty soon.
Okay. Well, thank you very much, and thank you all for joining us, and thanks to AARP for sponsoring this event. And with that, we're signing off.